not a government takeover. It's private doctors, private clinics, private insurance, and patients making up their own mind. They've got the freedom now. Patients get to choose their doctor. It's not a government takeover. And if you're in a small business, wake up. There's money on the table for you. If you're a small business owner with 24 or fewer employees, there's up to 35% tax credit coming back into your pocket this year already because of this new law. If you're a senior citizen, prevention. We're focusing on prevention. Mammograms, preventive services, no deductibles, no co-payments. That's what we succeeded in achieving.
Dan Flannery, now your question to Congressman Kagan.
Let's move to another key topic for a lot of voters in this district, Social Security. According to reports prepared for the Social Security Administration itself, funds for Social Security will be exhausted somewhere around 2037 to 2041. This solvency issue is not a new one, and a raft of proposals for saving or extending Social Security benefits have been debated for years. Where are you on this issue? In your opinion, and please don't speak from Mr. Ribble's view, what needs to be done to keep Social Security solvent for future generations, and what steps do you believe are necessary?
Well, thank you, Dan, for the question on Social Security. On this subject, there is a very clear distinction. We're very far apart about our views about Social Security. My record, you'll always know where I stand on Social Security. I have always said I will protect Social Security against anyone who would seek to privatize it, personalize it, or otherwise phase it out. Social Security is a sacred trust between one generation and the next. It is a winning Wisconsin idea, right here from Madison. It's the greatest anti-poverty program any government has ever created in human history. So it's sound until 2037, at which time 78% of your benefits will be available to you. So if we have to adjust anything, it would be the cap on income applicable to the Social Security tax. And if Warren Buffett is willing to pay the same tax rate as his secretary, I don't see any reason why the rest of us can't concede to do that as well. There's nothing wrong at all with everybody joining together and understanding that we're really all in this together. You are your brother's keeper. You are here in a community. And without Social Security, about 140,000 people, your neighbors, may not make it. Earlier today, I had a town hall, and a woman who was just making it on Social Security wondered why there wasn't a cost of living increase. Well, with the devaluation of everything because of Wall Street financial collapse, the formula said there's no increase. So I put forward 2 pieces of legislation to help her and everyone else that's on a fixed income. What did I do? I co-sponsored legislation that would guarantee $250 immediately to help her get through the next several months. And also to eliminate any income tax on someone 65 years of age and older with an income annually of below $50,000. So on this subject of Social Security, there's a clear contrast between my opponent and myself.
The follow-up question, you mentioned raising the income cap. That's one of the issues, one of the fixes that's been talked about, raising the income cap, raising the retirement age, doing means testing for benefits. How many of those are long-term solutions, and how many of them are Band-Aids that get us through a shorter period?
Let me tell you what I won't do. I will not vote to cut benefits. I will not vote to increase the age at which you can retire to claim the benefits that you've already worked so hard to earn. I will not do those things. But part of fixing Social Security is fixing our economy and making sure we have more people at work, paying taxes that will pay it forward. That's the whole concept of Social Security. But on this subject, we're clearly different. When Reid was interviewed on a radio channel, Voice of Liberty, he said these words, Social Security, quote, this is about patronage. This was about buying votes. It was never intended to be a legitimate program ever, close quotes. So on Social Security, Reid and I have a vastly different point of view about Social Security. I'll fight hard to protect it. Reid has said we're going to phase it out.
Mr. Ribble, I'll rephrase the initial question. We've got a system that's about ready to expire in 2037 or thereabouts. What needs to be done to make it solvent for future generations?
Sure. I love it when politicians who've been in office for 4 years and haven't done anything about it talk about what they're going to do. So here's the reality. There's been about $1 million smear campaign run on television Good night. My wife is a grandmother. I want her to get her Social Security, but she's not even convinced she's going to get it. It's really been something. It's been almost surreal. I have said from the very beginning that when I got in this race, that we have made promises, we, the American people, have made promises to our seniors and those near retirement, and we have to keep those promises. But I also said that I've got a 4-year-old grandson, and we need to keep our promise to him as well. And we've got a problem in this country because the fact of the matter is we can deny demographics. We cannot deny that we've got an aging workforce. We can deny that we've got a birth rate that's just at replacement level. We can deny that there won't be enough workers for my 4-year-old grandson when he gets to be 65. And then just let them take the 25% hit. Or we can today stop demagoguing. We can stop politicizing. We can stop using senior scare tactics. We can stop manipulating politics. And we can get business, but it's going to take grown-ups. It's going to take people that will stop threatening seniors. It's going to take people to stop manipulating things and lying about things. It's going to take real grown-ups. We need to put them in a room and say our objectives are simple. We're going to work and protect our seniors, and we're going to find a solution for our children. Now let's come together and develop that plan so that both seniors and children, this generation and that generation and the next generation, have a Social Security system that's secure for them, that recognizes those other things like changing demographics. And that is what I've been advocating from the very beginning. There's been a distortion about my position on Social Security. I have never once said that we should take Social Security away from any senior. Never once.
So let me ask that follow-up question again. Many of the fixes that have been talked about, raising the income cap, retirement age, means testing, things like that, how many of those are really good long-term fixes? How many of those are just Band-Aids?
Sure. I think that raising the cap on the wage is where you pay. Social Security is a relatively regressive tax because it stops at $106,000. And so when Citigroup gave away their $100 million of bonuses, there were no Social Security taxes paid for that money. And so that's certainly one of the fixes that have to be on the table. I'm concerned about raising the retirement age, although that may be something that we look at over time as medicine has improved, as Americans are living healthier lives longer. You may want to consider that. In fact, the Congress did that when Ronald Reagan was president. They considered it, actually implemented a 2-year increase. I go back to what I said at the beginning. What we need to do is we need to look at all of these options to create a long-term solution that works for our seniors and my grandson.
Congressman Kagan, final thoughts?
I didn't hear an answer to the question about how he's going to fix it, but he did say during a Fox Valley Initiative candidate forum that, quote, somehow we have to establish a phase out of the current Social Security system to a new system. That will have to happen over time. It could happen in a single generation. And he finished with these words. It will probably require a fair amount of change in the retirement age, close quotes. So his position today is different than it was back then. He was seriously considering increasing the age at which you could claim your benefits.
Mr. Rimmel, final thoughts?
Yeah, and just as a point of order, I have a single notepad here, which is what the rules were. The 2-term congressman still has crib notes. It wasn't allowed. But I will say this, that I've been very specific on how and when and the ideas that we should use to change the Social Security system so that it will work for all Americans, young and old.
Now let's move to Shirley Strange. She will be asking the next question to Mr. Reed Rimmel.
Mr. Rimmel, Medicare. Medicare trustees have warned that the trust's assets are likely to be exhausted by 2019. After 2019, monthly Medicare taxes will cover only 79% of Part A's benefits and progressively less over time. What does Congress have to do to make Medicare Part A financially sound over the long run?
Yeah. Medicare is a real problem. And in fact, it was the driving force, I believe, on why health care reform needed to happen. The numbers simply don't work. And if we look at the unfunded liability for Medicare, it's currently at $74 trillion. This is an enormous number. In fact, the total net worth of the American people Their real estate and businesses is only 72 trillion. So we've got a mathematical problem. The system cannot sustain itself, and the rate of growth cannot continue to be there, or it can't be done. And so things have to change. And some things that could be done that I felt, and this is what I felt, we missed out on the healthcare reform, was really getting to a place where we started to target in and focus in on health outcomes earlier in the process. One of the things I liked about the healthcare bill was the fact that parents could have children in their program or their family plan a little bit longer, because then we can get those young adults into the system sooner, which would help as you start to build a history with their family practice physicians and wellness programs. The other things that we could do is begin to encourage businesses to have wellness programs, health fitness programs within their companies, so that we can get to a better health outcome during those years that we're working. If we can get to a healthier class of senior citizens, we can begin to get costs down a bit. And that's one of the things that we can talk about.
And the follow-up, would you be willing to support the solvency of Medicare with any of the following measures? Pay a premium for Medicare Part A benefits, pay higher co-payments, and or increase the Medicare payroll tax. If not, what are your solutions?
Yeah, I think at some point prior to 2019, some of those are going to have to be looked at, including the Medicare tax. You're going to have to take a look at the numbers simply don't work. You're going to go upside down. And so, but if we could get at some of these other things that would actually drive the cost of healthcare down, like tort reform, what I talked about earlier, if we could get that in there. The experts have told me 8 to 11% savings there. If we could let large organizations pool large risk pools together, buy across state lines, we could drive costs down there. And then the cost on Medicare would also be reduced. And so it's not either or, it might be a both and it might be a combination of many things. And in fact, medicine and science itself might come up with some solutions along the way as well at the rate that is included.
Thank you. Congressman Kagan, Medicare trustees have warned that the trust's assets are likely to be exhausted by 2019. After 2019, monthly Medicare taxes will cover only 79% of Part A's benefits and progressively less over time. What does Congress have to do to make Medicare Part A financially sound over the long run?
Well, within the new health care law, we have instituted some measures to begin to do that. A number of efforts have been made. First, to do an Institute of Medicine study looking at regional and geographic payment differences. You may not be aware, and the listeners may not be aware, but the doctors and the hospitals here in Northeast Wisconsin provide some of the highest quality care anywhere in the country. We have some of the best experts anywhere you can find. And yet Medicare will pay those physicians and those hospitals significantly less than they pay down in Florida or Texas or other states. So we have to fix the geographical disparity. I've pushed very hard to get that into our new law. And you'll see in our district about $65 million more dollars from Medicare coming in to help our hospitals, which need help the most. Because today, whether you like it or not, they're providing services to Medicare patients and Medicaid below where they can make a profit. So if Medicare is paying below the overhead, that cost shifts to everybody else. So the other thing to do is to make sure that we understand where the expense is going to balloon. The largest entitlement program ever created by our government was Medicare Part D. Hasn't been paid for. So we have to have the right to negotiate for lower drug prices for prescription drugs, putting large risk pools together, putting a purchasing pool together, and compel the drug companies who are opposed to my election, if you've been watching it on television. Make the drug companies compete. Let them openly disclose their prices. Let's put our purchasing pools together to drive prices down. But the most effective way of eliminating some of the cost in Medicare is to root out and eliminate all the wasteful spending. I'll give you just a little example. $425 is what they'll pay for Medicare, but we